viewers, good to see you back here. The second episode is here for you now. Let's dive deeper into our topic, the roles of pharmacists in immunization today. Here's a disclaimer before we proceed to the video. The views expressed in this video are solely representing the opinions of Mr. Huin and will not reflect any standpoints on behalf of the Malaysian Pharmacy Students Association, MyPSA.
So basically, those medical staff duty on a consent taken station. Okay, so we're there to assess their current medication or also medical history. Okay, if a patient are having previous serious allergic reaction, like shortness of breath to their certain medication, maybe ibuprofen, or maybe they have allergic to certain vaccines. So we need to make a remark there for them to observe for a longer period of time after the injection. For other public, they are taking some kind of medication, normally are immunosuppressants, okay, like DMARDs, alright, and also some cancer patients or patients with anticoagulant like warfarin. They also need a special schedule for their usual dose of medicine, or they might need to defer the vaccination until they completed the chemotherapy, or they need a special counseling to reduce the side effects after the vaccination. So patients having these comorbidities or special medication, they will need a special counseling session that we are done together as well. Okay, there are more things that we need to tell the patient. Alright, so we will need an established training program for our pharmacists to learn on the vaccinations. Because we are not exposed to practical vaccination during the university, so we should go through a proper training or proper module to learn on the vaccination and what to do if really anything happens. Actually, a few pharmacist organization has already starting this module, and the Malaysia Ministry is recognizing them. So more publicity will be needed to publicize this event to all the pharmacists in Malaysia, so that we can take up the responsibility to join the program and to vaccinate more people, and also to achieve the herd immunity easier. Basically, I also one of the approved vaccinators already. Just that not all people know this program, but actually the program is quite good as well. Basically, they are separated into a few parts. The first part will be on the basic life support. We will learn on, let's say, any emergency happen, like maybe the patient collapse, or maybe the patient has any emergency. That what should we do? The second thing is about the vaccines, so including the storing the vaccine, like the transportation that I mentioned just now, to make sure the cold chain is maintained. We also learn on the different injection technique. We also learn on how to constitute the vaccine vial. Basically, I think this all we have we have a brief introduction during the university already, but then we really get into hands-on after working as a pharmacist. So they have more like a refreshing course for us to learn how to reconstitute a vial, how to take out the vaccines from the vial without spoiling. Okay, all they need a skill. Okay, how to inject the patient, which angle you should inject. Okay, so also all this we learn based on the online module that time. Okay, then we also go to a place for a practical assessment as well. So there will be a professional there to assess us on the basic life support skills and also the injection skill. A doctor will be there to observe how do we actually inject real vaccines, okay, into the patient. Then we are only acknowledged as trained vaccinators. During the starting phase, public might not be confident in getting their vaccine dose in the community pharmacy. I think this is one of the challenges that we might face in the future. So it's very important for us to educate on this as well. Pharmacists should get adequate trainings on the vaccination program, so the public will be a confidence on us as well. A really good training module should be introduced to enhance the skills of a pharmacist. So I think we can have more publicity on the social media, including those on TV, radio as well. Okay, we don't publicize our own service, but we tell it as a general way. So to let you know, actually, oh, you can do this like this. We can collaborate with the newspaper. Okay, the newspaper can just say, okay, pharmacists are now vaccinators. So everyone reading the newspaper, they will know about that. So actually, it's more on publicity. So healthcare knowledge is actually evolving all the time. Okay, the thing that you are learning in your lecture now might not be applicable when you are start working. The medical field can change so fast. Okay, like the coming of COVID-19 has actually changed so many things, right? Okay, we need to keep ourselves updated. We should keep ourselves a habit of reading or to attend CME, like those online training or the new guideline updates. Okay, actually there are many courses that are free of charge. So I will encourage the students to take up these courses and to learn together on the new knowledge. Okay, we are not only there to educate our customer, our patients. Actually, we should be a good educator on medical field to our friends and our families as well. So I think all the students should take up the role or the responsibility to be an educator of medical knowledge around their family members as well. So that's all from me today. Thank you for listening. Hope to see you again. Bye bye.
That's the end of our sharing on this topic today. Hope you enjoyed the video and see you again in the next Pharmaceutical series. Stay tuned!